As society evolves, incorporating more and more advancements and innovations, an odd new phenomenon that we've never really seen before has appeared: back pain in children. Well, according to new research on the subject, this issue seems to be becoming an epidemic of sorts. And joining me now to tell us more about this issue, and more importantly, what's being done about it, is Dr. Yossi Dabush, a chiropractor from the Israeli N.S.A. Chiropractic Center. Thank you very much for coming in, Yossi.
Thanks for having me.
Appreciate it. Now, what, in your words, what is causing this epidemic or phenomenon?
Well, let me tell you, this is not an epidemic, and this is not a disease at all. This is pain, and so let's go briefly about what pain is. Okay, so pain is not the thing. It's not the pain is a messenger. It is not the message. Okay, the pain is trying to tell us that something is going on abnormally. Okay. So this is really important to tell everybody that addressing the pain is a mistake. Okay, we need to understand where it is coming from.
Okay. So when did we first learn about this? When did this start?
Well, pain indicates something. We do not want to kill the pain. We do not want to use painkillers. So what we do is we listen to it. We listen to not only listen, I mean, we check, we examine the child. And it is a fact that many children are coming in with back pain, and this is new. This wasn't here 15 years ago or 10 years ago.
I mean, so what's causing it then?
Well, what will cause it? Basically, children are spending so much time sitting, not running around like they used to do. They are holding their smartphones, they slouch, their head goes forward, that will close the rib cage, their breath will go down, circulation becomes poor, and overall the body gets into stress. And when the body is getting into stress, it causes a defense mechanism to go active.
So what are we doing about it?
Well, first we need to understand what is going on. So when a child presents with pain, we need to not only look at the area of pain, but try to understand what's going on. So we'll talk to his parents. In the intake, we'll have history, medical history, and personal history. So we understand where this child is coming from, how is he in the world, okay? And then we will, after we understand the mechanism, we'll check the nervous system and see how the nervous system contributes or how it is being affected. Because, I see by your face that you don't see the relationships between the pain.
No, I do. I'm kind of in shock because, I'm thinking about this, and this sounds like all the problems that people have been warning adults for years, like stop slouching, maybe get up and move.
Exactly. Okay. So by analyzing the nervous system, we have a chance to understand what's going on in this child's life. And then by doing the right action, I'm a chiropractor, I'm an N.S.A. chiropractor, I will touch this child in different areas that will cause his nervous system to wake up. And and so nervous system restores function, normal function. So we spend so much time talking about disease, but disease is only maybe 8 to 10% of what's going on. The other 90% is not being discussed. I see. People in the other 90% are spending life in dis-ease. Okay, this is prior to disease. We want to take them from dis-ease to normal.
So in just a few short words, because unfortunately we run out of time, what is your advice to society as a whole to avoid this problem?
Well, first get checked by chiropractors. It's crucial, really important to make sure the nervous system works well. Then do your children a favor. Don't give them smartphones freely. Make sure they go out, they run around, they do sports. Make sure that they eat real food, okay? All of these combined will improve the situation greatly.
All right. Thank you so much, Dr. Yossi Dabush.
Thank you.